So thank you everyone for being here. Welcome to our session on a Monday afternoon. I'm Sheena Arthur, I'm Partnership Manager at Glasgow Council for the Voluntary Sector and really delighted to be here today. We are going to get some insights from the Archbishops Commission, Reimagining Social Care, with Dr. Anna Dixon, who was one of the chairs of the commission. So we've got a really great opportunity to hear about that work. Just before we start, I just wanted to acknowledge that the work commissioned by the Archbishops of Canterbury and York does have consideration for theological, it's underpinned by theological understanding, but when you look at the report and the values and all the insights within it, it's absolutely aligned with our World Reimagined, our Reimagining Social Care discussions that we're having here in Glasgow and beyond. And it's really strong, the values, the valuing people, and a couple of quotes that came from that, valuing people for who they are, not what they produce, was really strongly aligned with a lot of the discussion we're having, and something I know we're really passionate about in our work within health and social care. And also that social care in itself, I remember last year a big discussion about, can we get the social back in health and social care? And very much aligned with that, a quote within the report that social care is not an end in itself, but a means to a better life. And that absolutely resonates with lots of the conversations that we've been having. So I'm not going to yabber on because we've got precious time with Dr. Anna Dixon. Delighted to have you here. Thank you so much. We're going to hear from Anna, and then we're going to hear from Lynn Campbell, who's Welfare Officer at Glasgow's Golden Generation, to give us a little bit of her local perspective. And that's going to be after a bit of discussion in the first part of the session. So we're just shuggling things about a little bit so that we get Lynn's insight as Welfare Officer working with older people in the city. So welcome everyone. If you'd rather not have your camera on, please do participate as you are comfortable. We are recording, and I'm going to hand over. Thank you very much, Anna.
Thank you so much, Sheena, and good afternoon, everyone. Thank you for joining today and for inviting me to speak with you. So I was inspired in some ways by my time in Scotland. Well, I wasn't in Scotland, but I am during COVID. I participated in the advisory group for Derek Feely's review of adult social care in Scotland. And I found the discussions that we did a lot of engagement with different groups across Scotland and people with lived experience and carers. And I found it really inspiring but also disturbing, I suppose, just even in Scotland, where we tend to think you've gone further with integration, that, you know, there was still a huge gap between the aspiration and the reality. So that work was just completing in early 2021 when I got a phone call, which you don't get every day, from the office of the Archbishop of Canterbury. And I thought, oh my goodness, what's this about? And they explained that they were setting up an independent commission to look at the future of social care in England. And would I be interested? Well, certainly at that point, there was just a litany of broken promises around the reform of care and support in England, a long overdue promise of a white paper, and really no action. And so it seemed like a really positive opportunity to try and, I guess, put some sort of energy back into the idea that actually care and support could be better, could be different. So that's sort of what I said yes to. So in the time that we've got, I want to just share a little bit about what the Commission did, what we heard, because like the Feely Review, we did quite an extended period of listening, and what we have recommended, and how that's hopefully going to change things for the better, at least here where I am now in England. So and I hope some of that and the questions will help you reflect back as to where have things got to in Scotland, where some of the proposals around the National Care Service have got to, and what might be the role particularly of community and the voluntary sector in that. So hopefully that be useful. Just a word on my background. I've worked in health and social care in a number of different roles. So I've advised government here in Department of Health and Social Care. I was Director of Policy at the King's Fund, and latterly I set up and led a charity called the Centre for Ageing Better, which was all about how do we help change policy and practice so more of us live a good later life, and that touched on all sorts of areas like housing and pensions as well. So that's a little bit about me and how I came to be doing this role of chairing the Archbishops Commission. It's actually an Archbishops plural, because in the end it was both the Archbishop of Canterbury and the Archbishop of York who co-sponsored the commission, and the sort of terms of reference that they set for us was to reimagine care and support. So this word reimagining, which I think you're also using, and really to think about what needs to change in order that everyone, regardless of age and ability, is able to live a full life. Now we looked, we had to sort of curtail our scope slightly, so excluded children. So it was really looking at adults with disability and right through into older age. And we did also sort of park the issue around end of life care. So we, but otherwise we were thinking about all the sorts of care and support that people might need with both physical and mental health issues, learning disabilities, etc. So we worked for about 18 months, and our report was published in January, Care and Support Reimagined, a National Care Covenant for England. As Sheena said at the beginning, one of the unique things about this was, whilst it's a Church of England sponsored commission, the commissioners that came together were either of all faiths, no faith, and certainly different denominations. We were asked to draw on Christian theology, principles and values. So we did have a theologian, and I had a co-chair who was the Bishop of Carlisle. So he has been the lead in the House of Lords on health and social care. But the membership of the commission was quite varied, and we had people who have their own personal experience and who are advocates in the disability and social care space, as well as others with more sort of policy and expert knowledge. So we did a period of listening. We engaged with people who draw on care and support their carers and paid carers, as well as organisations. And I guess, it's probably not surprising, and many of these things were quite similar to what the Feely Review we heard in Scotland, and I'm sure you continue to hear from people involved in your own organisations. The care system is far too complex and confusing, and people spend a lot of time navigating. In fact, we heard people say, they wanted care to be a right, not a fight. It did feel sometimes we heard the language of sort of battling and fighting to get anything, not to get just the right thing. And obviously this came, we were still coming out of COVID, if we could say that. But unsurprisingly, a lot of the unpaid carers were feeling burnt out. With the withdrawal of services during COVID, a lot of family, we know a lot of people increased the number of hours that they were having to provide care. But obviously, with shortages of care workers, with people having left the sector, also those care workers we spoke to who are paid workers were also reporting similarly that they felt very overstretched and undervalued. I think a recurring theme, particularly acute here, but I'm interested to know whether this has been resolved any better in Scotland, is this sort of poorly coordinated. And it's not just NHS and social care. Obviously, for some people, those are the services they most frequently use, but it extends to housing, to benefits, just the lack of, you know, meeting people's holistic needs. And so that was quite a significant theme. But of course, you know, amongst the sort of more challenging things we heard positives, in particular about the role that communities play. And obviously, again, we saw through mutual aid and so neighbourliness just how people could come together. But we also heard specifically about the positive role that churches and other faith communities, we specifically went to and invited faith groups to come and talk to us, and carers who also were members of faith communities, to understand how they were being included, supported, enabled to participate fully through their communities. And we heard a lot of positive stories. We heard about local government, that there were some local authorities who were doing really like proactive community-led initiatives to try and ensure that people got early support in their communities, and were enabling people to sort of use assets and strengths. And of course, there was a huge appreciation for the amazing work that family carers and care workers were doing. What we found, I think, most difficult in the sort of what did we hear was when we tried to ask people, so if you could have your wish, if you could wave a wand or have your prayers answered and, you know, get the care and support that you really want, what does that look like? And I think we found that people were so constrained by, you know, the limited amount of care and support and the sort of low expectations in a way, because things have been so bad, that it was actually quite hard to get people to express what something quite radically different would look like. But we did do that, and we drew that out from people, and we also looked at theology to help inform our thinking. We looked back at various policy documents and other statements that had been put together to look at what were they saying about the future. And this was sort of broadly what we came to in the end. So really this idea that, yes, care and support is not a service, it is not an end in itself, but it is a means to enable people to flourish, to live life to the full. So this sort of idea in theology of abundant life, about life to all its fullness. The second was, you know, these sort of idea of universality, that we are all created in God's image, that therefore we this is something that affects all of us, and we wanted to underpin that with concepts of sort of justice and fairness. So that led us to talk about the need for access to and funding of care to be universal and fair. We were sometimes told that people didn't like the word care, and we explored this a bit. And it's almost because of people's experiences of the care sector or the care system or care services as being quite negative. They didn't like the word care. But rather than abandon it, we decided actually, you know, let's get back to the true meaning of care, that the love is at the heart of caring. And therefore, how we care, whether it's family members or paid workers, that it needs to reflect love and empathy. So those were sort of ways in which we reflected values. The other coming from this idea was that society, but also churches and faith communities, needed to be inclusive and recognise that everybody has something to contribute, and how we enable people to participate. So rather than being recipients or users, this idea of empowering people and including people and valuing people. And then finally, a lot of the language we found in policy was all about independence, choice and control. And what was coming out from our reflections with people was that actually care was about relationship, and it was about interdependence and mutuality. And so that was really, again, a sort of fundamental for us, that a test, I suppose, of our vision would be to the extent to which it enabled this sort of mutuality and interdependence between people. So that was our vision that came out of our listening. So then we had to sort of think, well, what needs to change if we're going to realise our vision? And so we organised our recommendations in 3 areas, which would be great to get some discussion going around each of these. So the first one was the need to rethink attitudes. Firstly, our attitudes to care, but also to ageing and disability. The second, which really was at the heart of what here is this idea of a national care covenant. So this is about rebalancing the roles between the state, family, community and individual. So a lot of the debate, particularly here in England, has yo-yoed between what is the role of the state and what is the role of the individual. And, you know, basically the state has been sort of very limited in what it provides. And then there's this idea that, you know, individuals should be sort of responsible. And most of that discussion has been who pays, you know, how much does the state pay and how much the individual pay, and has largely ignored the contribution of families and communities. So that was part of what we were putting forward. And then the third area, I guess, gets into how do people experience getting access to care and the sort of points I made about navigating. So how do we redesign the system? And we basically said, no tinkering around the edges. This needs a fundamental redesign. It needs to look very different from how it looks today. So those are the 3 areas where we put forward, and I'll just touch on these briefly as we go through, and then hopefully we'll have some time to discuss these. So in rethinking attitudes, as I say, like a lot of the way people understand care and support is very much about meeting basic needs and what's often called personal care. But it was clear, you know, we need to see, if we want to see care and support as an enabler, that actually it's about meeting people's spiritual, emotional, as well as practical support. This idea of universality, I think we really need to get home. Like, this isn't something that just older people or vulnerable people, that all the othering, but let's see this as something that at some point in our lives, we are either going to be caring or need care. And, you know, the sooner we understand that actually it affects us as a society, this is about our, you know, our brothers, mothers, sisters, daughters, it's about all of us. And that's really important. But we did want to challenge the underpinning attitudes. We felt that care and support kept getting deprioritized politically because of the stigma and discrimination that is associated with age and disability. And so we took the view that we were never going to really see change in the way we wanted on social care unless it also went hand in hand with a shift in wider attitudes. So that was our first area. The second area, as I mentioned, was this idea that we should set out more clearly, and a covenant we chose rather than a contract, because a covenant, it has obviously theological resonance, was really about a sort of trust-based mutual agreement, and we felt that that was much more the nature of what was needed, and not a transactional contract. And so the idea would be that we would develop, and probably led by government, but very much through deep public dialogue, develop a national care covenant, which would set out, a bit like we have an NHS constitution, I'm not sure if you have one in Scotland, which sort of sets out, these are the principles and values, this is what you can expect, these are the roles and responsibilities of different you know, entities, the state, communities, etc. And then we broke down within it and said, well, this is what we'd like to see in it. We would like to see a stronger commitment to support communities, a new deal for unpaid family carers, a stronger role for the state, because we think that, you know, the state hasn't done enough, that there should be stronger entitlements. And then finally, our responsibilities as citizens. I won't go into all of these, so you can have a look in the summary report, but just to touch on a couple that I thought would be most relevant to you, was this idea of community. So already lots of people were telling us how important community was to them living a full life and the sort of support they got from the community. But we know that a lot of that is not available to everyone everywhere. It can be quite patchy, depending who you are, where you live, how poor you are, etc. So, and that this community support doesn't just sort of it's not just there, it needs nurturing and investment. And I hope this is a positive message for you as voluntary sector organisations across the city and in Glasgow and across Scotland, that communities do need investment and nurture. And we largely saw that as a role for local authorities, but not exclusively. And we certainly thought that there should be other funding other than statutory funding put into effectively a community chest or a community fund that can help to support this sort of asset-based approach to communities and nurturing them. Clearly, there needs to be infrastructure that enables this as well. And that, again, we felt was a part of the wider local government role, whether that's about accessible transport, community transport, accessible housing and planning, or indeed ensuring that some of that community infrastructure is there. But we also identified that there's quite a lot of assets within church and faith communities, not least buildings, but also people. And so something about how do we equip local church and faith communities to adopt a more asset-based approach to be more inclusive and more accessible. And that's something we are taking forward to try and develop resources and toolkits that take that sort of asset-based model and put it into practical tools for churches. And through our interfaith dialogue, we established that some of the other faiths, major faiths, were also very interested in equipping their own local synagogues and mosques and temples. So we hope that that might be something that can be developed on an interfaith basis. And I was interested that actually I think some parts of the Church of Scotland are working with an asset-based sort of community development approach in some of the poorer areas of Scotland. So there is precedent here. And then the second area I thought I would just touch on, because I'm guessing that some of you do work with carers as well, that we were quite radical here in saying that actually we want it to be restored to loving relationship. And for that, actually, the decision to provide care and to receive care by people needs to be voluntary, so that it's out of love and not necessity. But that's only possible if you have a decently funded and accessible statutory system of care and support. And that when people do choose to take on a significant amount of care and support, that they get, you know, the financial, practical and emotional support to do that. And that means recognition financially as well. It means restorative breaks, rights to rest, and where people want to carry on working, that they're supported to do so. So there's a number of recommendations, quite practical ones we've made about the need to have a new sort of deal, as it were, for what carers can expect. So that's covered the first two. I'm going to sort of pause there and see what Sheena wants to do, whether you want me to sort of carry on through to the sort of the third area. But I wondered whether we might pause just briefly to see if there are any sort of questions or reflections that people had so far, particularly on this idea of, like, you know, the role that communities can, should, do play in supporting people to live well. This idea of investing and nurturing, you know, what more is needed to empower communities. This idea of the role of church and faith communities, and then perhaps, you know, what is the deal for carers? What should the deal for carers be? So I don't know.
Yeah, thanks very much, Anna. I think this is, yeah, good to stop and reflect here, and also I think a good opportunity, because we've also got Lynn Campbell here from Glasgow's Golden Generation, who's going to join us just a little bit. So whilst people are maybe having a think and wanting to put something in the chat or come in, we could invite Lynn Campbell in at this point, although I see Martin's got in with a question straight away.
Sharing. Would that help?
Oh, yeah, that's lovely. Thank you. We can all see each other in the discussion. Thank you. So just as I was saying, giving people time in the chat, Martin has just put in, I think, a question about quality control implementation and any any dates for success? Have any dates been set?
Yeah, so we felt that this was really at least a 10-year time horizon to radically change, things like attitudinal change can take a long time. Some of the things that we were proposing but potentially need quite significant changes in levels of funding. And obviously we didn't expect that to be something that would be possible to change overnight. So we sort of broadly set this out as a 10-year plan for change. Where we are obviously politically, we've set our sights for some of these more radical changes, like the National Care Covenant, as being things that we would hope that political parties might take up in their manifestos ahead of the next general election, which we anticipate maybe next year. So that's another sort of, a timing issue. But we have also said some of this can change and change more quickly. There are practical things in there that local authorities are doing and can get on with. Obviously, with these sorts of independent commissions, the Church of England is looking at continuing to champion this as an issue and putting some of their own resources. But a lot of this is about how we've worked through the commission itself before we reported, to identify partners and get them on board with some of our recommendations. So, we're looking to other organisations, been doing some work with the Association of Directors of Adult Social Services here, housing, Lynn, that has a lot of housing representatives, with Social Care Futures, which is a user-led movement doing work around attitude change. So the idea really is that the implementation is taken forward not by the church, but by partners, although some of the recommendations, as I say, that did apply to the church specifically are being taken forward directly. So yes, it's not an overnight. When you're reimagining, wanting to do radical things, I think it's more of a longer term change. But thanks for the question.
Thank you. Thanks very much. Lynn, could invite you in, thinking about community and some of that that valuing people.
Yeah.
Is there anything that's resonating with you?
Loads. And I think everybody agree. Hello, everybody. My name's Lynn Campbell, and I'm a welfare officer. Well, one of the welfare officers at Glasgow's Golden Generation. I've actually been working for the charity when it was Glasgow People's Welfare, 23 years. And Anna, I think we are a lot better off in Scotland. We are so lucky in Scotland because we have free personal care. Now, it's only because I can talk about elderly people, because that is my role within helping elderly people. What I would like to say is that at Glasgow's Golden Generation, what we do here is, I feel personally, what we do is that we're a one-stop shop here. We do income maximisation through benefits and entitlement to benefits, because people don't know enough about what they are entitled to. And that part has not changed in 23 years. There's still this, if you don't ask, you don't get. There are non-means tested benefits that trigger off so much. So, and I'm going to try and keep this short. So intervention is prevention. If you go in and you maximise people's incomes with what they're entitled to through benefits, through the knowledge of knowing what they're entitled to, from the client to the carer, to the people, the support network run about them. At Glasgow's Golden Generation, when we get a referral, we go out and we tell people of what all the projects that Glasgow's Golden Generation does. We have daycare. So if we're maximising people's income and trying to get them to integrate again, we offer them the daycare facility, which there is a charge for daycare. There's a charge for everything. We can also offer a befriending project. That's to get to the hard to reach, to the housebound, the people that aren't getting out back in to integrate and get social interaction. To move into the 21st century, we have a digital project which is run at both our day centres, and that's to help the older people not to be so frightened, even if it's the minimalistic thing as trying to show them how to do their emails or do anything online that keeps them in touch with families that maybe no be in Scotland, or maybe other parts of Scotland that they can't get to see them. So that's why I feel that we are the one-stop shop. What we also do is we are partnered with community connectors, keeping in touch with the GP surgeries. The community connectors are great. The carers associations all around Glasgow. And my colleague Maureen Maley, who's on as well, she'll tell you the same thing. The recipient, when you get a referral, we worked alongside the home falls prevention for a long time through the NHS, again getting to the hard to reach. When you were getting that recipient and you looked after them with their entitlement to benefit, telling them about daycare and everything, it's the carer. Carers always worried me for 23 years who recognised the carer, and the carer needs support. And in Scotland, again, Anna, we're very well aware of what's happening with carers and how difficult it is for them financially if they have to reduce their working hours. So they're a wee bit kinder here in Scotland. They get a carer's premium twice a year, and I see you smiling. No, it's never enough. There's never enough money. But again, the incentive is there. Even if they only get an underlying entitlement, that still protects their state pension for years they're losing and working and paying a carer's credit. Again, they don't know enough information about that. And they think, again, there's a moral issue around that as well, because why would a daughter or a son want to claim carer's allowance for looking after mum, dad, aunt and uncle? Morally, that goes against their grain. So we have that job of explaining to them, it's not just about getting the money. That you may have to decrease your hours if you're an unpaid carer and you have that underlying entitlement. That will protect you with your workplace. There's loads of things that branch off from just getting those initial benefits. And I think that's where it's very important. That's where the intervention comes. Everybody, every scale and every level is looking for money, whether you're the recipient or the employer. Most people, like our charity, we rely on volunteers to come into our day centres to help us. Everybody's felt the cost of living. Everybody's felt it coming out of the pandemic. I do feel volunteers are gold, and we should value the volunteers more. And they're only doing it out of the goodness of their own heart because maybe they've had a family member that they once cared for, and it's very difficult to stop caring when you've been a carer for 10 and 15 years, so they can use the skills that they've got. To bring all this together, Anna, is word of mouth. Again, letting people know what is going on in your community, to me, is the best thing. There's a lot of larger communities in Glasgow that do have those outreach projects, and they do have good community funding. But it's getting to know about it. It's just letting this gives you a platform. Things like this gives you a platform to tell others what your organisation does. And it is like reinventing the wheel, because social work and third sector have always worked together. Maybe not always have been recognised, but we both need each other. And I think that's what we've seen through the pandemic, that where people were working remotely from home, they could only do so much. People weren't wanting me to maximise their benefits. They were wanting somebody to talk to. And that's where we got our Careline project from that. Then that's where we got our befriending project coming out, because we can see that older people are not as confident coming out of the pandemic as what we wanted them to be. I kind of think I could say 100 different things, but I do think in Scotland we're a wee bit more aware. I think the carers' premiums are good. It doesn't equivalent a wage for what people are losing in the income, but at least if we inform people more and get the word out there. And again, from the diversity point, I was out giving a talk to the Jewish community. We do the Ali Butt Society, the Shanti Bhavan, the Chinese community. We have a wee blether every week for people who are over 80, and they started through our digital project, just being able to go on and teach them how to do emails and how to do FaceTime because of the pandemic. Now that has continued for 3 years, but they come on with the simplest of things. Like they'll say, Karen, is Lynn there because my bins never get emptied, or how do I contact us? But we've also took them on to do the digital project. We've also took them into the day centres. So again, it's that domino effect of having that information there And that's how I can say that I feel with the one-stop shop for to get people, get the confidence up again. In the 20 years, what I have noticed, an 80-year-old 20 years ago is not like an 80-year-old now. You are not old at 70. You're still very active. You still want to go out and do things. A lot of our volunteers are people who have just finished work at 68, 69 and 70, and they're still bringing in fresh ideas. They've still got the enthusiasm to help. And I think, again, it's just getting the platforms, getting the word out there. I can't say anything about it politically or going financially, but everybody needs the money. We all need money, and that goes from your local community, your local churches. People, they have to know what's there, they have to know what's available, and we're only one voice, we're only one small charity in Glasgow. And I just think spreading the word, let people know what's going on in your community. I think we should all take a wee leaf out the pandemic when we were all out clapping for carers. Every single person should give themselves a pat in the back for coming out of this pandemic and getting here. But keep it going, keep chapping the doors, look for that person that you haven't seen for 2 or 3 days. And where I live, I do live in a small area, but it is a good community. But there's a lot of larger areas in Glasgow that have just went right back in and went, right, I'm all right, Jack, and let's go on with it. And we need money. The local authority, the funding, it's just no there. And that's the unfortunate thing. That's the unfortunate thing is time is your most precious commodity to give to anybody from any denomination. And that I do agree with Anna. I think everybody should have a wee bit of reflection and say, well, what can I do now? I should still be able to help with what I've done in the pandemic, and I should still feel that I want to help. And I don't think anybody that works in the third sector doesn't care. If you didn't care, you wouldn't work in the third sector. We would not be doing what we're doing if we didn't care. We all have that element of care, and we just want to try and get it right. It's never going to be perfect, but just get it right for a wee while till something else comes along. I don't know what else I can say to you, but
thank you.
Thanks anyway. Thank you.
Thank you, Lynn, so much. I'm smiling away listening to you because I think what Anna's saying and what Lynn are saying are very similar about the way you say it might be different. And I love the notion that we're much kinder in Scotland. Of course, I love that, but I'm not so sure that we're all experiencing that, but I love that. And I think that's sometimes the challenge. We had a bit of that conversation last week with the our event with Scottish Women's Budget Group about our perception and our vision and what we hope for, and actually what the experience is of people. And I think that's the bit I loved Lynn saying, Anna, the thing is, to get this done, it's word of mouth. It's that what you're talking about, community, faiths, interfaith, other values, not about faith, but how we can come together. And that's really the important bit. And I would agree with what Lynn's saying there about we saw amazing things happen during the pandemic, and I do feel we're seeing people retreat, and in terms of our health and social care system, the kind of let's do it approach, and I know some of that's about legislation, we've kind of retreated back to our default settings, if you like. So how do we keep that kind of energy? You said that right at the start, Anna, that you signed up for that, getting the energy around the system. So how do we do some of that, get the energy there to support all that, that care and love and compassion that we know is there?
Yeah, it was great. Thank you so much, Lynn, for sharing. You know, I think that's the thing. It does come down to this sort of, you know, community, and we can try all sorts of, you know, interventions, and, you know, there's lots that technology can do. But at the end of the day, we felt that it was those human relationships, mostly communities of place, but there are also other types of community. And, you know, that mutuality of supporting one another. So you use the language of volunteers, but it's actually quite interesting, and indeed carers. Lots of people don't identify themselves as carers or indeed as volunteers. They're just helping. They're, you know, they're helping out, they're helping their neighbour, they're helping the mum, you know. And I think sometimes this system likes to organise people and label people and go, you're a user, you're somebody who needs care and support, you're a volunteer, you're doing this role. When in fact, actually, we're all part of, you know, overlapping communities and in relationship. And the key, and obviously this is where I think, you know, your role of community connectors, so having people whose job it is to help make those relationships work, to empower people and help people, connect people who are not, give them confidence. You're sort of befriending and buddying. You know, not everybody's confident to participate. So how do you help them? And then making sure they're all go-to organizations like yourselves, and there would be others. And some, I think we need to equip churches to be, and faith communities to be better go-to places as well, that they can signpost people, they can give them the right information about what's out there, whether it's benefits or it's health and social care services, or it's, you know, other information about other voluntary sector things they can join in with. So I think you illustrated very much like when we use the word community, what are we really talking about? And I think it's a bit of all of those. So thanks for bringing it to life.
Thank you. And when you're talking there, Anna, about that, the skills, you know, people are helping and they might not think I'm doing befriending or I'm doing this. I'm thinking about some of the work around suicide prevention, where somebody was saying, you know, there's different bits of training for people working or volunteering in a very defined space. But what about the people who are, you know, over the garden gate or bump into someone when they're out in the street or going shopping? So how do we, I guess, just help us be comfortable with what's maybe, we don't have that issue in Glasgow because lots of us know you can stand at the bus stop and share lots of things and have lots of discussion. But how do we support that informal bit and know that we're not saying the wrong thing or doing the wrong thing?
So I think that was the point about investing and nurturing. And I see that Katie's put a question in about this. So I think what we're saying, you know, there is a role effectively for the state to, whether that's expressed through local authorities, to fund certain amount of community infrastructure. I mean, we see a little bit of this in terms of local authorities maybe giving out grants to voluntary organisations, or the NHS now funding link workers. These are examples in England, a bit like community connectors, and the social prescribing, which is now sort of going on in the NHS. So these are initiatives that are, you know, statutory services are sort of doing, and funding is coming. So I think it does need that, it does need money, but it also needs leadership. Definitely agree with that. And I think we're saying, you know, yes, I mean, the voluntary sector already taking, you know, leadership role in many places, although, you know, we sometimes would challenge some parts of the voluntary sector are not necessarily taking an asset-based approach, and certainly churches and faith communities, we would be urging them to do so. I don't know, Sheena, if you want me to sort of move on to the third and final section of what I was going to share with people today, and then we can get into conversation. I'm hoping that it's going to be the right bit of my PowerPoint, so do tell me if that's not showing the right bit.
Okay, I'm just going to thank Lynn because I think she needs to not get locked in her building before she goes, so thanks very much. We did have a short break, but are people comfortable that we carry on and go into discussion? If people feel, I can't see everyone to know. Oh, I'm getting a thumbs up. Thanks, Peter. Well, if people do need a break, obviously you could put your camera off, but thank you. I think we'll carry on and have time for discussion. And
thanks very much. Thank you.
Thank you.
Yeah, so the third area was this idea that we needed a radical redesign, and in contrast to the current system, which is complex and fragmented, to have something that's much simpler to understand, to access, to navigate, that's consistent. So one of the other things is that people, you know, obviously by local authority are getting very variable amounts of care and support depending on where they live, but we also heard that people getting very variable amounts of care, you know, depending on their age or their disability, and that, you know, who their provider was, whether they were taking a direct payment or not, that there was not really any consistency. And unfortunately, despite the fact that we've had, you know, commitments from the Care Act onwards around the need for more self-directed support and the, you know, there are the opportunities for direct payments, that is still not the reality. So again, we see this as a long-term aspiration, but that care and support should move towards becoming a much more universal entitlement. So it's very heavily rationed, a very means test at the moment, and sort of like no elements really that are universal. So what we ultimately are proposing is that there be a much more simplified assessment process. So people found currently the way that assessments work was very bureaucratic, tick boxy, and not a very satisfying process either for the worker doing it or the person who was being assessed. And I guess that whole sense of being assessed, it's a sort of being done to. And instead, we heard about sort of system in Australia where there are sort of, I guess it's a bit more like within a welfare model, you know, there would be categories of need and a simpler assessment, and then a guaranteed sort of budget or entitlement that everybody with that level of need would be in receipt of. That, you know, our thoughts about the sort of trust that people should be trusted to decide about their own care and what they need, set their own, not only set their own goals, but take much more control about how those outcomes are achieved and allowed to take risk, basically. So we understood that the system's very risk averse and, you know, not enabling people to take, you know, risks that we would all choose to take in order to have a bit of fun in our lives. So how we do that. And then finally, and I think, you know, this idea of sort of, yes, people need information, but some people also potentially need advocacy to make sure they actually get the rights and entitlements. And we felt that was a very important part of what a new system should look like. So those are sort of the domain. And then we took a number of different areas and looked at these in a bit more detail. So obviously, how housing works at the moment we don't think supports people to live a full life, and that to complement a different system of care and support, we also needed diverse housing options. We were clear that some people would still need to live in perhaps more specialist settings, but very clear that we saw some great examples of where those are much more integrated into the community and in a way more fluid, with people coming in and out, people from going out into the community and the community sort of coming in, and so those sorts of options we felt should be much more widely available, as well as making sure that mainstream housing is built to be more accessible. So the Church of England is a landowner, it has assets and investments, so we were urging them to use them to help to accelerate this diversification. But we also recognise that at the moment, certainly in England, part of the problem about why private equity is sort of moved in and dominating is because they can capitalise, particularly because of property values and land values. And what we were finding and hearing was that not-for-profits who've got different models or less capital rich providers, so obviously, you know, dom care, or if you want to do a shared lives model or something like that, it's much harder to get the sort of access to social investment and long-term capital. So we made some recommendations about how that needed to change. We hear lots, don't we, about the potential of technology, although we must always remember, I think somebody in the chat was reminding, you know, about digital exclusion, and that is still very real. But that there would be opportunities, I think, with some of the more intuitive and that to build in person-centered technology into homes and into the way we live. And I think we have already seen the power of sort of everyday technology, whether that's the, you know, your voice activated device, so, you know, having reminders, or even just touchscreen tablets that can allow you to do much more in your own home. So those were things we felt probably most realistically were things that could benefit. You know, we had a question mark and felt that, you know, the potential of things like AI and robotics needed a lot more testing, and indeed with people, to really see what the potential of that was. And there's no point having technology if you don't train carers and care workers, indeed users, people who draw on care and support themselves. So it's absolutely vital that there's training, and that the technologies themselves need to be inclusive and affordable and accessible as possible. So those were some of the things we said about technology. And then there's the final area just to touch on in our redesign was the workforce. So of course, there's lots of talk about pay, conditions, shortages of workers, training, career progression. And, you know, I think we agreed with a lot of what's being recommended about, you know, about all of those, and potentially over the longer term, achieving greater parity of value in terms of the NHS. At the moment, you obviously see people doing similar roles on very different pay. But we also, I guess, coming from our value-based approach, felt that it was really important in thinking about the workforce, there was a sort of redesigning of the roles. So you've got people with direct payments on the one hand, employing personal assistants whose whole ethos is very much about enabling the person. And yet here you've often got care workers where it's much more time and task, you know, personal care tasks. And really we felt that there was a need to, I guess, value both the time people spend and to achieve the value of continuity of relationship, and that actually co-designing some of these, you know, roles. So taking the best of PAs, and could we look at a different care worker role that looked more about empowering, enabling, potentially, and doing so with the people who deliver care and the people who draw on care and support. Making sure that in the recruitment and reward that there's a lot of focus on purpose, behaviours and attitudes, as well as obviously on skills. And then I think the other thing is the need for a much longer term workforce plan, to deliver, you know, a career really for people, so that career caring, you know, is a growth industry in terms of jobs, and so we need to make sure there's a plan for how that happens. So those are some of the elements of sort of our redesign. Now, I'm conscious that some of that might not read across quite so directly into the Scottish, although I've tried to keep away from some of the more technical changes, which would be more aligned to the current policy and legal framework in England, and focus on things that I hope would have some generic relevance. But I suppose, good, you know, a question we've said on a journey to universality. We haven't chosen to call that a national care service, but we have said there should be stronger national entitlements, and we've called it a national care covenant. But maybe some of these proposals have relevance in how the national care service is being implemented. Obviously, self-directed support has been around quite a long time. I think the Feely review, you know, renewed that focus, but highlighted the massive implementation gap between what's said in the rhetoric of policy and what people actually experience. You know, that remains, I think, a challenge. And then obviously issues that we've touched on, like housing, technology and workforce. I've put a few questions there in case people were interested in sharing any reflections. But that's what I wanted to say about the Archbishops Commission. I do hope you know, maybe have a look at the report and see some of the things that we're saying. Thank you.
Thank you very much. And it is so relevant. I see Lynn has put that in the chat as well. Absolutely. The way it's framed or described might be different, but there's similar themes, absolutely, in terms of universal access to care. We've got some questions coming in, so I want to make sure people get a chance for discussion. And there's a couple of themes I'm noting about accessibility and design, and you mentioned co-design there, Anna. So Martin put something in the chat a little bit ago about access and inclusion, and also then Martin and Angela a bit about cost, profit, that sort of, which you've touched on, and it came up last week when we had a session with the Scottish Women's Budget Group about should there be profit within social care, and reinvesting, so that there's definitely a theme there if we can maybe explore. Do people want to come in to ask their question, or just invite people if they do? I can't see everyone's hands at the moment, if anyone's got their hand up, but do we go to discussion on those themes?
Can I pick up Martin's point about the pay and stuff? Sheena, is that okay? I think
Martin's mic's not working, he's just said. So
oh,
yes.
Sorry, Martin. It's fine. Well, I was going to pick your question about paying conditions is a really important one, because it's a huge part of the National Care Service work in Scotland is to look at national wage bargaining and national standards and a whole range of work, which for me probably is one of the strongest elements that where we are just now making the legislation linked to the care service in Scotland has been paused for now, and it's not entirely clear how things will develop. That said, there is a lot of engagement work going on with the Scottish Government just now. They're reaching out, they're planning a number of regional events, certainly in Glasgow, so keep your eyes on the Scottish Government website and also our website for that detail as well. But yeah, it's a big issue. So I've just seen Martin's comment about being delighted his mic's not working. I'm sure that's not the case, Martin. Yeah, so the whole pay and conditions issue is something that I think even in Scotland with the living wage for care workers is still a massive issue, and recruitment in Scotland's a big issue as well.
Do you want me to reflect on that as well? So yes. Yeah, I mean, I think clearly minimum pay levels are not what they need to be, full stop, never mind in the care sector. And I think the idea of a sort of sector pay deal is a good one, and actually finding a way when it's public service commissioned providers that they are tied in to a pay deal. Obviously, where it's self-funders and private providers, that's much more difficult. But I think it's a good start, and given how many providers do take at least some people who are publicly funded, I think it could get a big chunk of the sector and improve pay. I think the other sort of aspect of this is the sort of leakage, as it were, in terms of for profit. And I know, obviously I was part of the Feely review. The decision or the recommendation was not to nationalise, but certainly was to look at ways of curbing what you might call excess profit. And I think, it's awful, isn't it, when people are taking home a minimum wage or receiving poor quality care and support, and the companies are still managing to either take profit or debt interest payments out of a provider. So we talked about the fact we saw a lot of not-for-profits that were value-based, delivering quality, who were effectively subsidising the additional quality elements of their care through charitable funding often. Ideally, they would have that properly funded. And I think we felt there were some things that were limiting the growth of the not-for-profit sector. So I think there's something about you know, at the moment, the odds seem to be stacked the wrong way. So how do you actually, rather than a blanket ban or nationalisation, how do you promote the not-for-profit sector and ensure that it can grow and get the investment that it needs, at the same time putting some brakes on curtailing the excess profits of some for-profit providers who seem to be extracting that at the expense of workers and people who draw on care.
Yeah, thank you. That there was a bit of that discussion in our session last week about actually we don't want to dampen the sort of specialisms or the breadth of diversity of options that people might have, but how do we make sure it's that investment bit?
So the other point that I'd like to make is just to make, we've said that the uplift in direct payments needs to be equivalent to allow people who employ directly to also pay a fair wage. So I know a lot of people, I mean, we hear a lot about the workforce shortages, but, you know, are struggling to hire PAs for the same reasons that it's a tight labour market, and they can't match on wage because the direct payments are not, you know, been calculated to allow you to pay a decent wage. So I think we must make sure that in any settlement that we don't sort of, in a sense, advertently give pay rise to one set of workers and leave people who are trying to employ PAs unable to match that.
Yeah, thank you. Angela, has that covered your comment or question? I could see you nodding there when Anna was talking. Yes, did you want to come in?
No, I was just I think that was fine. It was just really about, and we're seeing there's been discussions just now about the private sector, and you know whether there will be a need for maybe somebody to do that to employ people and as a PA, but the kind of private sector I was thinking about was care homes, where you know you're using public funding to pay a private sector company for the care of somebody, and they're making a profit on that, and that just doesn't sit right with me in terms of we shouldn't be funding these large companies and allowing them to make profit out of social care. But that's just my personal opinion.
Yeah, thanks, Angela. And I see Martin's put in the chat, the not-for-profit can sometimes not reinvest, so it's the money's not being invested where it's needed, so there is.
Yeah, it's not a perfect thing. I totally agree. It's not as simple as, you know, all public good or all not-for-profit good and all private and for-profit bad. So I think, you know, we definitely need to look at the quality of the service. We need to look at pay levels. So those are all factors. I thought it was interesting. I mean, the Women's Budget Group have done some good work on care. I'm interested. I'll look at the Scottish link. Thank you for sharing that. I think we need to remember that, you know, most of the unpaid carers we're talking about are women, and most of the paid care workers we're talking about are women. And so these changes, we've argued, as well as sort of being moral and principled, we are recognising and making the argument that these are equality issues. These are economic issues. You know, if you put better wages into these people's pockets, this money will get spent in the real economy. It will help to lift some families. You know, there's evidence from a study by the Health Foundation about how many care workers families are in poverty, children in poverty. So, you know, this is, you know, there are a number of levels on which this is the right thing to do. So, yeah.
Yeah, thank you. And it absolutely aligns with discussion from the work the Scottish Women's Budget Group have done around what you're saying there about investment, about valuing people and the people who are predominantly working or unpaid carers in this space. There is an inequality there. And also I was just checking what Sarah had said last week, and one of the things when you were being asked about timescales, and you're saying, you know, it's not a quick fix, it's a longer vision. That was absolutely, Sarah said, it's the long haul. That's what she said last week. This isn't you know,
and it's very difficult to say that when people have been, I mean, this is like so long overdue. So the other perspective is that we look back and you sort of go, how is it that, you know, the world has changed, like the number of people living into adulthood with disability, the number of people living into later life, you know, living longer, has changed so radically, and yet we're still failing to provide a decent level of care and support. And so you sort of look back and go, you know, this should have, and you look abroad, you know, you look at Germany, 1999 coming out of like, you know, they made big changes, Japan, you know, people have been making these changes like more than 20 years ago in other countries. So on the one hand, it's like, it's long overdue, like we need to be like sorting this now. This really can't wait. And certainly in terms of like an urgent need for some of the injections of funding to bring up levels of care and support to address some of the workforce issues are very urgent. On the other hand, I think, you know, we've got to be realistic that given where we're starting from, which is, you know, a very, very low base, in terms of public provision, moving towards something that is much more generous, much more universal, you know, really radical in terms of personalization, like changing the attitudes, how people practice, you know, unpicking the current provider market and replacing that with something that looks quite different and dynamic. Like that, you know, let's set the vision, let's start going in the right direction at least, but let's also be realistic that that isn't an overnight change. So in some ways I'm like sorry to hear that things have stalled in Scotland, you know, in terms of progress on the National Care Service. I guess I'd be more interested, like okay, that's at the national politics level. At the sort of, I guess, local level, the community level, this idea of this sort of implementation gap between what we know good care looks like and what people are getting, you know, does that feel like it's also stalled, or is there some momentum towards still trying to pursue a different vision for what care should be like?
Thank you. I saw Lynn with her hand up, so I'm going to see if she wants to.
Yes, I was going to just say, Jen, yeah, and I think the implementation gap is, I think that the Feely review obviously strongly picked up on that, as you know, hasn't changed. We're seeing local cuts here and elsewhere in Scotland, significant cuts to social care, partly down to, I guess, additional money being swallowed up by inflation and costs and so on as well. I've been thinking a lot about this because as a former carer and activist, but also just generally in terms of the work we're doing at JCBS and listening to the voluntary sector in the city is, and looking at the still lack of political will around this, and I don't know how we challenge that. And I think I loved the Commission's report, because I think you thought through some of those issues around how do we tackle some of that, and part of it I think is around saying, not offering stuff in bite-sized chunks, but saying to politicians, this is a long haul, but here's what you can do now that will change people's lives and change them for the better. So the issue around, you know, like care charging, which is a live debate in Scotland just now, and a big issue we've picked up on. How do we get money to the front line? And there's a political debate here around the National Care Service, the national stuff versus what happens locally. So we haven't moved forward since Feely, which is a shame. People might disagree, and you know, fair dues, but certainly our view is that we haven't moved forward. And I think politicians in Scotland are struggling, I think, and given all the challenges we've all been through, you know, I understand politicians and what they're challenging, but I think they're struggling to say, well, how do we move this forward? And I think it goes back to your view, but just finally, your view on value in the report, I think is absolutely spot on. We do not value people with disabilities. We don't value carers or older people. And I think until we do that, that action is less likely, I think. I hope not, but yeah.
So I think this thing about how do we make it a must do, you know, and so this is where we came to at number one, why we put Be Thinking attitudes number one, because it's almost the necessary prerequisite to some of the other things that we think need to change. And with that, this sort of idea, like we've we've ended up defining care and support by the terrible quality and ration service, rather than as, you know, having a right to a good life, you know, and really like making visible the positive difference that when people have the support, they can, and when they live in the right environment and not a disabling environment. So I think that's really what we're trying to sort of, when we say changing attitudes, yes, to age and disability and discrimination, but also like, what is this thing? Why is it so important? And this idea that it does affect us all, you know, trying to sort of, because so many of us do, like, you know, experience this one way or another, and yet why is that not as visible as, you know, and appealing as, say, the NHS? So, you know, I think for us, that number one thing about how do we change attitudes, because, you know, it's ultimately the public demanding this is what we want that will shift politicians.
Yeah, thank you. Absolutely. And I think there's some of the chat is agreeing with that, and thinking about that attitude change. That isn't about money straight immediately. That's about how we think, how we value people, how we see the difference between somebody's contribution and what they bring rather than what they need.
Yeah.
And one of the archbishops said, I think in the intro bit, I really liked because we have a bit of a debate, I feel, in our health and social care system about like the programme of work I work within. It's called Maximising Independence, and that's not a comfortable phrase for lots of people. But in the report, there's talk about interdependency, and I really like that sort of, I thrive if you thrive, or what you do helps me thrive. And I think we're so far off that because we've got caught in, like Martin's saying, you know, we can't have a 10-day deadline, we've got a 10-year plan, and we don't start, in my view, the first 10-year plan and we're on to the next one, you know, and we haven't actually, we've got lots of good thinking, but that back to that question about the implementation gap, I think we absolutely have that gap, and not necessarily intentionally, but maybe you know, decisions being made that are further away from people and what they actually need and want. And maybe people thinking, yeah, we've done that because we've got SDS, for example, but actually it's not working out the way it was anticipated for.
So I think that the other factors that we think will make a difference, so the National Care Covenant is partly also to make much more visible, and you know, people don't realise that they don't get social care until they need it. So by having a much more visible document and discussion, that we think as well is a factor in helping to make people realise what little they currently get, and therefore they might want to demand more. So we think that process of developing and making visible National Care Covenant is also quite an important component to achieving, like, it's a change mechanism in its own right. And then the other, I suppose, behind this, and why I guess we don't have like a 10-year timeline with milestones, particularly because some of this is about a movement for change. So trying to ignite quite a lot of different fires, I suppose, you know, so that, you know, again, it builds momentum in different places and by different people.
Yeah, thank you. I like that. I'm visual. I'm seeing lots of little fires getting, not in a risky way. Now we've got Kasarma, who's patiently waiting and can't find or can't access the reactions. I'd like to invite Kasarma to come in. Thank you.
Sorry, my name is Maureen Kosa. But what happens is it's how it's coming up because it's saved that way in my work email. Wait to see, I'll put my camera on.
Oh, thanks, Maureen. So I'm giving you an exotic name there.
I thought, is there somebody else like myself that can't find a hand in here? Oh, and my camera's not even working, so I'll just switch it off again. Hi, I work with the Care Inspectorate. I only moved to the Care Inspectorate in September and had worked in the NHS prior to that for many years. And a lot of, it's really interesting that I'm now looking at things from a social care perspective and just seeing the reaction. So interestingly, the National Care Service and the Feely report was part of my presentation for my interviews. So you know how I'd done an awful lot of homework on it, and it really quite excited me, because predominantly when I worked in the NHS, I was a community mental health nurse for older adults and worked with a huge number of people with dementia. And I think what some people don't recognise is that people only know how the majority of people only ask for care when they really, really need it. They don't know how they don't set out to get anything that they don't deserve. And a lot of time, my time was spent trying to convince people that this could make a difference in their life and could prevent somebody ending up in long-term care as well. So, but the challenge that they then had was that they then had to go through this circus of asking for support and the amount of time that it took. So when I heard that there was going to be this national care service that could support people and make sure that people are entitled to what they deserve and what can support them to live a good quality of life, know how actually live life rather than just existing, I was really excited about it. So I'm interested in seeing that there is some resistance to the National Care Service. And I think one of the key drivers for that is the feeling that the money that it's taken to put a National Care Service in place could go to staffing. And I think it's hugely important, because when we look at the third sector, the voluntary sector and social staff, the costs, the wages are getting are really poor. And if you look at the turnover of staff, it's huge. And then when they're saying that people aren't getting a good level of care, you actually recognise why, because and I know within the NHS, because I was involved in interviewing and staff retention, that we have an issue across Scotland in the health and the social care sector, but the cost, the wages that people are getting in social care, if you compare a nurse within social care and within the NHS, their wages are different. So people are choosing to go where the money is, which they absolutely have to do. People only get into caring if they want to care, but why would you not go somewhere where your value is recognised more? That then takes us on to training, because people need the training that's required to provide a good quality of care. But training has been provided repeatedly, but when you've got that turnover of staff and you've not got the people that you can mirror good care from because of the huge turnover of staff, it's a real issue. So I do think they need to look at trying to keep people in jobs, and then we can look at how best we can support people in the training side of things and getting good quality of care there. Now, if that comes in a national platform, absolutely brilliant. Also, I'm a real advocate for including the family carers where they're able to. I don't think there should ever be a pressure on loved ones, know how it should be involving them and having them as active participants and actually listening to them, because who knows that person best than their loved ones know how. So how do we make sure that there's that participation across the piece and that families are seen as equals in providing this care or providing the information where people perhaps aren't able to provide it themselves? So I'm really keen to drive it all forward, but I think that we absolutely need to look at staffing levels and how do we get people in and how do we keep them in jobs as well.
Thanks, Maureen. We're going to be having some discussions, facilitating some sessions for the Scottish Government. I'm thinking we need your messages in there about value, about recruitment, about mirroring, good care and retention. I think probably our last question or comment, Amanda's patiently waiting. I'd like to invite you in, Amanda, and then, sorry, Anna, you might have reflections on what's just been said.
Hi, sorry, I just wanted to kind of more or less concur with the other people that have spoken. I am a carer. I care for my profoundly disabled daughter. And, you know, I couldn't agree more with what Lynn said earlier. You know, until we as a society value the people who require support, then I don't think very much, you know what I mean? We all have desires for things to change, but that is the fundamental change. That is the fundamental shift that there has to be in society, is that the people who require support, care, you call it what you want to call it, until they are valued and their wishes about how their support and care is taken forward, until that happens, you know, it's stuff in the wind, really, you know. I mean, it really is, you know. I mean, and you know, the last person who spoke, who was mentioned about recruitment and retention and stuff like that, I've just had a situation where you've got, within Scotland, you've got personal assistants. There's so much goes on about, you know, how much people can pay depending on what local authority you're in, what your personal assistant's wages can be versus what an agency will charge. The turnover of staff, I couldn't agree more about. My daughter requires consistency of staff. That's just as important as actually having a provider, because there isn't that consistency there. You don't, it's not nice to say that you get the bottom of the barrel, but you know, if you're going to give somebody £10.90 an hour, you know, and you expect someone to put their heart and soul into that job for £10.90 an hour, you know, I mean, people do there's genuinely nice people out there and really great people out there, but people are also put into situations where they're taken on by agencies, then put into services that they should never be put into, and you know, when they first start out, especially if they've come from school, you know, and they're just coming into the caring profession, and then all of a sudden they're put in an environment that they think, I don't need this, I don't want this, I didn't think it was going to be like this. And people are left without support. The turnover of staff is horrendous. People don't care. You're not a person, you're a number, you're a shift to fill. You know what I mean? You're a gap somewhere. You know, this is my life. You also have a situation in local authorities in Scotland where some local authorities do not consider taking on family members. They won't allow family members to be paid support. It's all about, it's not changing the narrative as such. It's reframing everything. You have to come from it from a different angle, and you have to look at even the language that we use, service users, you know, things that a lot of people find upsetting. You know, even as we said earlier, some people don't realise they're carers. Other people don't want to be carers, and they want to support their loved one rather than care for them, if that makes sense. But I couldn't agree more. And retention training, I agree with that as well. And even then, from a personal assistant point of view, local authorities won't give family members under direct payment option 1 resources to have a budget for training. It's just, yeah, the list is endless. I'm really sorry to sound so pessimistic. I really want to be very optimistic, so I do apologise.
Thanks, Amanda, and please don't apologise. We really appreciate you sharing your experience. It's really important, and thank you for having the energy to do so. We really appreciate that. We've only got a few minutes. We thought we were finishing early because you didn't get a break.
We got that wrong, didn't we?
So I'm gonna, Anna, is there anything?
Yeah, just to thank
we...
everyone, and particularly thank you, Amanda, you know, for sharing, and for all you obviously do, you know, despite how difficult it is, you know, that's why I did what I did in the commission, because it's just not acceptable that it should be so difficult. And as you say, like, we have to change this, and it is about, you know, changing hearts and minds about disability and people's attitudes to that. And that you know, I do come back to that was our number one proposal, and we do think that without it, as you say, like, none of the other things will really happen or stick, you know, because lots of things have been tried and then they don't stick. Money, you know, for this project, that project, you know, we don't see things through in the way that we've talked about. And I think that goes to our attitudes to care workers, as there's, I think, Maureen, you also powerfully put, you know, we are putting people into situations where they cannot do a good job. You know, we're not giving them the support, the training, the good management, any of the things to succeed in the job. And so whilst a lot of people were in the job not for the pay, but for being able to provide, you know, the good stuff, you know, to see people flourish, to be able to provide good care, the minute that's no longer possible, a lot of those people have left. It's not all to go and get a better paid job in the supermarket, as we tend to hear. For quite a lot of people, it's because they can't do the job that they came into it to do. I think we need to remember that as well. So, you know, it is, I don't want to end on a depressing note either, because the whole point was to give hope in our commission, to give hope that we could reimagine and that things could be very different. And I do believe they could be, but we absolutely need to tackle attitudes, put this up the political priorities, and you know, and make a reality on lots of the promises that have been made. So thank you all, and thank you for inviting me to join you.
Thank you very much for your time and sharing all these insights. And I think we can end on being hopeful that we absolutely have to change. We can't keep going as we are. It's not sustainable, and we actually have lots of opportunity if we change the mindset. And that's a very short sentence, but I know it's a huge challenge. But I'd love to hear more about the covenant and how we can make that a reality and really create the change that we're all talking about. So Lynn, it's over to you to just bring us all together and make that happen.
If only. Thanks, Amanda. I want to say some things from Sheena and I are both have caring roles. I had caring roles, and my husband died last year, so I totally appreciate everything you're saying in terms of where we are in Scotland. However, to end on that positive note, I want to say, Anna, thanks to the church for being involved. I think it's really important that churches are more, and I want to use the word political, because I think it's really important that they are, and they have a say on these matters. And politicians do step up and take notice, believe it or not. I think it's really important that the people like the Archbishops are speaking out. So thank you for that. And I think we are in a position in Scotland where we can create change. We just need to make sure we don't lose the momentum with the National Care Service and the debate that's been created by the work of Feely. And certainly at GCVS, people continue to push for change. That's been part of our role, because yes, we represent the third sector, but the sector tells us about what's happening, and we know from experience about where the challenges are. So we will continue to speak up on these issues and challenge, but also just that all of us have a role to kind of put pressure at politicians to challenge them and say, you have to think differently. You have to recognise the value of social care and what it contributes. And for Amanda's sake, and for anybody else who uses social care who needs it, that social care has value in so many levels, and that actually a good society cannot thrive without good social care. So thank you all for taking part today. Really appreciate it. And thanks to Anna. Huge thank you to Anna. Absolutely.
Thank you.
Thanks, Sheena. Thanks all. Cheers.